Hey team, it's your nurse educator Amy here, and welcome to part 3 of my series on understanding hemodynamics. In this video, I'm going to be discussing afterload, which is one of our determinants of cardiac output. So let's get started. So remember, afterload is one of the variables that determines stroke volume, which is ultimately going to determine the cardiac output of the patient. Now, afterload is the amount of pressure that the heart has to pump against to get that blood out. And we've already discussed that the heart is a Goldilocks. It does like a little bit of pressure to pump against so that we can really make sure that that blood gets to the body. But if that pressure becomes too high, it's going to be very difficult for the heart to pump out that blood. So we really like for it to be a good amount of pressure. Now, the two types of hemodynamic parameters that we're going to use to measure afterload in the body are SVR and PVR. Now, SVR is going to be the afterload on the left side of the heart. And SVR is really the systemic vascular resistance. So the vascular resistance in the body, all of our extremities in the core, right? So notice how the pressure on the SVR is 800 to 1200. So that's really what we're shooting for. Whereas the PVR is pulmonary vascular resistance, and that's going to be the afterload on the right side of the heart. So pulmonary vascular resistance, that's going to be on the pulmonary side of things. Notice how this number is much smaller than SVR, and that's because there's not as much surface area in the lungs as there is in the rest of the body. So the left side has to pump against a much higher afterload than the right side. Now, some of the problems that we tend to think about when we think of afterload issues are things like sepsis, where you can have really dilated vessels. We can also have hypertensive crises. So there's a bunch of different things there. And whenever you're thinking about interventions that we can do to correct those issues, we're really, again, looking at things to increase afterload. So with our septic patients, if their vessels are really dilated, we need to increase the afterload so that we can ensure that all of that blood gets to the body. So think of things like your vasopressors, your Levophed, your neosynephrine, your vasopressin, and even your dopamine. That's going to increase that SVR so we can ensure all of that blood gets pumped out to the body. Now, if we're running into problems where we have too high of an afterload and we're really having a hard time getting that blood out of the heart, we can do things to decrease the afterload in the body. So this would be venodilators, arteriodilators. Nitroglycerin is a venous dilator, so it's going to help dilate the veins of the body. Whereas nitroprusside is an arteriodilator. It's going to help dilate the arteries of the body. We can also use hydralazine, which is more on the arterial side. We can also use ACE inhibitors. That's, again, going to help decrease afterload. And this is why a lot of our heart failure patients are on ACE inhibitors. It makes it a lot easier for the heart to work and pump out that blood to the body. And then finally, calcium channel blockers. Again, calcium channel blockers have a smooth muscle relaxation quality to them. So it's going to help decrease your afterload. So again, when you're thinking about afterload, I want you to think the pressure that the heart has to pump against. If it's too high, it's going to be really difficult for that heart to pump out blood. If it's too low, it's going to be really hard to maintain perfusion to the body. So again, I hope this video helped you guys. Stay tuned for the next part in this series, and please make sure and like and subscribe so that you don't miss any more of my videos. I'll see you in the next one.